Thank you. So, first of all, I welcome all of you to this webinar conducted by Arthrix and Breg. So, I'm very honored to be invited for this, and thank you all the organizers for the same. So, as we are about to start 2025, so we are about 25 years into the new millennium. So, the biography, the geography, the entire genesis of the problems of the knee joint has come to the fore. I mean, if you see 25, 30 years before, many people, they were consigned to the life of pain. I mean, as they cross 55, 60, they will say, oh, I'm old and I'm okay. It's okay if I suffer. I will take a steak or I will go to my local doctor. I'll take some tablets if the pain is too much. And gradually they will change their lifestyle in such a way that will suit their pain. So they will lose on to their social activities, their shopping, meeting their friends, meeting relatives, enjoying festivals, so far and so not. And our Indian lifestyle is also not like a Western lifestyle. It's quite demanding. People used to use Indian toilets where you have to squat continuously. I mean, those things, they take a toll on the knee over a long period of time. So knee joint is one of the most complex joints in our body, although it can flex, extend, and twist from side to side, and it also has about 2 to 3 degrees of rotation. And the weight is supposed to be distributed evenly through the joint, because at various points, because it's one of the main pivots on which we stand, it is the main pivot on which we are going to run. And if you have to accelerate, it is one of the main pivot. If you have to turn, it is one of the main pivot. So as so far, since it's the most important joint and it's so important, it is still vulnerable to the injury. Now, coming to the anatomy, I mean, the knee joint, basically, I call them, you've got, its knee joint is like a fort. So you've got two sentries which are inside the fort and two sentries which are standing outside. The collateral ligaments are protecting the knee from the outside, preventing any external twist. And the cruciate ligaments, the posterior and the anterior cruciate ligament, they prevent the anterior and the posterior twisting of the knee. Now, what are the most common causes of the knee pain? So it can be some kind of inflammation like bursitis, quadriceps hamstring tendinitis, or the end stage of various inflammation like arthritis. At the patellar level, patellofemoral syndrome, chondromalacia patella is again very, very common. Patellar tracking disorders can be seen in people who have had dislocations of the patella in the past, or some people have habitual dislocation. So they can also be classified as a instability. Some people have a poor geometry of the femoral condyle, leading to the patella tracking disorders. In runners, you have got runners, and marathoners, you have got patella stress fracture. And all these together for many years together will lead to patellofemoral or osteoarthritis. To a small extent, Hoffa's pad fat, especially in very active individuals, they also play a role. Below the knee in pediatric age group, you have tibial tuberosity where the patella tendon is attaching. If there is a disintegrated growth of the same, it's the Osgood-Schlatter disease. And if the same thing develops when the person is an adult, it becomes as osteochondritis dissecans. So hamstring tendinitis, and inside the ligament injuries, ACL, PCL injuries, Baker cyst is very common. I mean, Baker cyst is not very painful, and most of the times it's a coincidental finding if we take an MRI of the knee. But sometimes it can burst. When it bursts, it causes severe amount of pain. Then you've got cruciate ligament injury, the meniscus injury, the collateral ligament injury. And the most commonly seen in our patients with early arthritis is Pes-Sensorine bursitis. These are the inflammation of hamstring insertion over the proximal and the medial or the inner part of the tibia or the leg bone. Again, on the outer side, toward from the thigh to the lower part of the knee, you've got again the meniscal tear, iliotibial band, lateral collateral ligament, and sometimes in case of trauma, even the lateral tibial plateau fracture or a lateral condyle of the femur fracture. What are the causes of knee pain? If you have to generalize the issue, it can be a pain which is arising out of injury, either past, prior, or current injury. Mechanical problems because of day-to-day life. Some people who use, say, Indian toilets, they squat a lot, suddenly they become obese. people with some medical conditions. So, like in rickets, so they have a varus deformity of the knee. In hemophilias, you've got the knee involvement because of persistent effusion. Okay, so these kind of, or some kind of tumors or the inflammations of the knee, the infection of the knee. So these kind of conditions are the most common cause of knee pain. Any cause of knee pain has to be tumor, trauma, inflammation, infection. Any pain can be caused by these four things. Okay, so these are the commonly involved, commonly seen sports injuries, like meniscal tears, the ACL tears. Then you have got fractures. Okay, and same thing about the patella, the sublux patella. Okay, so this can lead to patellofemoral instability and later on patellofemoral arthritis. Also, some people may have a different, a problematic alignment of the knee, like a genuvarum or genuvalgum. Okay, this can lead to a little bit of internal or external rotation anatomy, and this is all linked. If you've got a flat foot, it will be compensated by a genuvalgum, and then you will have a increased anteversion or increased internal rotation of the hip, and also some amount of valgus in the hip. Okay, now osteoarthritis basically is a concentric loss of joint space in any joint. Now it is more specific and more commonly seen in knee joint in India because of our lifestyle, because of obesity, because of osteoporosis in a postmenopausal woman. Now, if it happens in a premenopausal woman around the age of 35 to 40, that can be classified as an inflammatory arthritis, or most commonly seen in rheumatoid arthritic patient. In long term gout patient, because of increased concentration of uric acid crystals also, it can be seen. So technically it can be divided into uh, osteoarthritis or syndromic arthritis. Syndromic arthritis can be rheumatoid arthritis, or because secondary to the gout. Other category is post-traumatic. Person who was otherwise healthy, he doesn't have rheumatoid arthritis or any other disease, but post-trauma, he has developed something called as a arthritis because of the misaligned or malunited fractures. Patellofemoral, again, it's chondromalacia because of very tight hamstring, sometimes because of excessive loading or excessive squatting lifestyle, increase in weight. This can also cause a patellofemoral digression or patellofemoral pain syndrome. Or also, it can also be classified as chondromalacia patella. So most common factors are over the age of 50, people over the age of 50, female, overweight. Why female? Because again, the menopause significantly weakens the vein. Any joint injury, repetitive again and again, if you are straining it, if you've got a ligament injury not treated properly, it will cause instability in the knee. There will be repeated small amount of strain every time the person walks, runs, jumps, or does any aggressive activity. And second thing is joint structure. If you've got a malaligned joint structure like a genuvarum, genuvalgum, later very early arthritis or later on very severe arthritis can develop. I also believe there is nothing called as a severe arthritis. They all start with a simple deformity. The deformity will increase as we start to ignore the proper management. Again, the ligament injuries has been discussed in the previous slides. So mechanism of injury can be a direct blow or a hyperextension or a twisting injury, a dashboard injury. Each and every injury explains a severe direct blow, hyperextension, dashboard injury. Most commonly leads to a PCL injury. Fall onto a fixed leg with foot infection also leads to a PCL injury. Same thing, a simple twisting injury will lead to a ACL injury. Most of the examination symptoms will be, there will be instability, there will be effusion. And, hello? So most of the ligament injuries will come with effusion, instability, pain, and which ultimately will settle down with the anti-inflammatory and braces and physiotherapy, but the instability will persist. Meniscal tears, on the other hand, are the painful problems. I mean, you won't have instability, you'll have frank pain. And if left untreated, it can lead to early arthritis. So again, you'll have unstable knee, slight instability, especially while going down the tear. There will be restricted range of motion, frequent locking if it's a large enough tear. Okay, and popping sound will be there. The most common condition is osteoarthritis, also known as knee OA. This happens basically because of excessive loading of the knee and lack of exercises, previous injury. As you can see in the image above, there is a frequent patchy loss of cartilage on the image on your right side. Okay, basically the cartilage is denuded, bare bone to bone is there, which leads to increased friction during the interaction between the bone to bone, leading to pain. As most of the advanced arthritis is when more than 3/4 of the cartilage is lost. As you can see in the video, the articular cartilage in a young person is so shiny, and as it ages, slowly, you can see the cartilage quality as well as the cartilage coverage is diminishing. On the X-ray, you will see there is a lack of joint space, which generally depicts the cartilage loss as well as the thinning of the meniscus. The alignment of the knee also will change over a period of time, leading to a bow legs or knock knees. You can see on the image here on the right and on the left hand side is the most normal. You can see how shiny and nice the cartilage is. Moderate loss of cartilage you can see, and then on the extreme right side you can see there is a complete loss of cartilage. Various classification systems are developed in which Kellgren-Lawrence grading scale uh, from grade 1 to grade 3. And here the involvement of all the three joints and the deformity are taken into consideration. Grade 4 being the most severe type and grade 1 being the non-severe type. Okay. So there will be a severe loss of joint space. There will also be a slight loss, and also there will be an obvious deformity. So the early signs and symptoms are clicking, and in the as far as the knee, there will be bone spur, reduced flexibility. Okay, what I have seen in our patient is if you have to ask them whether the arthritis has increased, you have to ask whether the style of walking, the speed of walking, and activity like going up and down the stairs has changed over a period of 1 year. If that is so, it means the disease has progressed. Risk factors, again, the age over 15 and most probably female, excessive BMI, genetic disorders like rickets, where you have deformed knees, and high impact physical activity like impact sports like football, where you have got constant injuries and previous ligament injuries. So there are two ways to look at it. I mean, everybody knows what is the cure. I mean, the cure is again, medicines are there, surgery is there, braces are there, but how to prevent them? Again, overweight and inactivity, any muscle injury, overuse or re-injury after knee surgery, knee injury should be looked at. Proper physiotherapy has to be done. Proper muscle conditioning has to be done. Physical workload has to be managed. I won't say we have to completely make the people, sit at home and not work. We can make them work, but it has to be managed and properly rotated. People have to be prepared. The muscle memory has to be created. And as the people are aging, then probably we have to supplement their calcium and sarcopenia, resulting in muscle weakness. We have to we have to start activating the muscles and make them do exercises. More you strengthen the muscle, the joint loads will be less and less, and leading to less and less wear and tear. Exercise, weight loss, and biomechanical aids, all three together can obviously prevent the formation of deformities, thereby preventing the osteoarthritis. So what you can do, some kind of strengthening exercise using a light TheraBand, low impact aerobic exercises, aquatic exercises, if you know swimming, are the best. And definitely you have to keep your weight in check. Now, what are the comorbidities which may prevent a future knee surgeries? Now, in my clinic, I see a lot of people who are 75, 80, who have had multiple surgeries in the past, or they have got a lot of comorbidity, very bad diabetes, cardiovascular problems, okay, kidney donors, or people who are on dialysis, chronic kidney disease, severe pulmonary disorder whose tolerance levels are very low, COPD, severe osteoporotic patients, and active infections. Inactive infection, or the person with on in whom previously there has been a lot of many incidences of infections in the past, are not a good candidates for surgery. Okay, so in this way, in these patients, we look for an alternative apart from surgeries to manage their pain. So hyaluronic acid and PRP or BMAC. In my opinion, towards hyaluronic acid is slightly biased, but I'm a big proponent of PRP or BMAC because these contain the natural healing factors, and up to grade 3 they work beautifully. And if along with them, if we supplement the deformity with a brace and a good and robust physiotherapy regimen, probably patients, these kind of patients, they do very well. Hyaluronic acid in some patients, they do very well up till grade 2, grade 1 arthritis, they do very well. Beyond that, the efficacy is also not very proven. Offloading knee braces are basically mechanical braces. They will look into the mechanical deformity, and because of the thumb wheel dial hinge, you can dial the amount of deformity which to be corrected. Now, these are quite modular in approach. Now, if you look at it, it's not a one size fixed all phenomenon over here. If the deformity is say 5 degrees, 7 degrees, 8 degrees, 10 degrees, each and every aspect of the deformity will be taken into consideration, and then it can be dialed in to change the alignment of the knee. So once you change the alignment of the knee itself is offloaded, thereby the pressure, if you can see on the image, once on the left x-ray and on the left image, on the left image where the brace is applied, you can see that as soon as the brace is applied, the alignment is changed. The knee which was in varus has been brought to somewhat neutral or slight overcorrected alignment, and you can see the appearance of the joint space in this patient. So what it has done is it has offloaded, or it has decongested the pressure points in the medial aspect of the knee. Now, same can be done in case of valgus knee. It can be done if the hinge can be on the other side. It can be corrected to the neutral alignment. So if the alignment wise the knee is fine, then the forces around the medial or the lateral aspect of the knee has been rearranged so that the pressure exerted on that particular condyle is reduced. So overall, if you see what happened, what does if there is a varus deformity, kindly follow my cursor. If the varus deformity, the force here under the circle is the maximum. So generally there is a stress shielding on the upper part of the tibia and stress shielding on the lower part of the femur. So what happens is this part of the knee is completely shielded from the stress. So that what that does, it changes the gait. The other part of the knee starts to become painful. The other knee starts to become the painful. So what this offloading brace does is it corrects the deformity, it realigns the knee, it realigns the forces around the knee. The stress is distributed equally, the gait is improved, the stability, the patient feels improved in stability. Most of the patient, if you see there is a gross amount of deformity, they have been walking without any kind of support or without any kind of weight, the risk of falling down is very, very high. If they fall down and break something, then probably they will require some form of surgery. Or if you see the fall risk, excuse me, the fall risk assessment in this kind of patient is quite high. So, and these patients, if they fall down, they don't do well. So this also acts as a preventive mechanism where the patient, it will prevent the fall and it will redistribute the forces. The patient can develop the joy of walking again. The simple task like walking around in the house, getting out of the house and walking for 1 or 2 blocks to do the things which are necessary for the patient, or his things of need. He can go to a grocery shop which is next door to his house and do his shopping and come back. He doesn't have to depend on anything. So this kind of thing is a boon to the patients on whom we cannot operate. Regenerating healing with PRP and stem cell therapy. Obviously, it's a evolving phenomena, but up till grade 3, it does a wonderful job. Okay, what it does is it will regenerate any torn meniscus or degenerative meniscal tear, and also the damaged the cartilage. It will try to heal some cartilage, but it should be given in conjunction with the bracing, so that the brace can also help in distributing the forces around the knee. So what you do, basically you take your own blood, all the components of the blood like platelet, plasma, WBC, RBC is separated, RBC is discarded, rest everything is mixed together in a centrifuge machine for 10 to 15 minutes, and then it is injected inside your knee. So it is natural, it is not synthetic, compared to hyaluronic acid injection, which is synthetic. So the healing factors are natural. It is not going to cause any kind of uh, uh, discomfort or any kind of adverse reaction. Okay. So in conclusion, the only thing I would like to see, the biologics have place in this world. The braces, especially the offloading kind of braces, are very helpful, and it's a very important armamentarium in our armamentarium in treating patients who cannot be operated. So I would recommend very actively used in patients who are 84, 85, dialyzed patient with severe cardiovascular issues, patients who have had previous infections in the knee, for whom surgery will definitely cause another infection. For them, this is a boon. Thank you.
Thank you very much, for your wonderful presentation. As you rightly said, there are a lot of multiple options, non-surgical treatment options are available to treat the patients affecting with the knee pain, especially on comorbidities where they are not able to go for a surgery. Definitely, there is a way for the patient to live their life without any pain. Thank you very much, doctor. While you are presenting, you are highlighted about the offloading braces, and my colleague is, with your kind permission, my colleague is going to present a small presentation on offloading braces, how it is going to be helpful for the patient. With your kind permission, just a few minutes. Then we'll go for a question and answer session. Thank you. Rogan, please go ahead.
Thank you, sir. Hi all, good evening. My name is Rohan Gentel. Today I am going to discuss about role of braces in osteoarthritis. So as we saw in doctor's presentation, osteoarthritis is a degenerative disease, and in that braces plays a major role in osteoarthritis management. So let's understand what brace is. Brace is a external device fitted to the affected or injured part of the body, and braces are available in different types. So today we are going to discuss about offloading braces. So what offloading brace and how it is different from the conservative or commonly found braces. So there are two types of braces over here. The first one is offloading brace, and the other one is a normal brace which we get in the market. So what offloading brace is? So offloading brace is nothing but a brace which transfers the load from the affected side of the knee to the unaffected side of the knee. So what is affected side of the knee? So as shared by doctor in the presentation, osteoarthritis is a disease where uh, cartilage of our knee, which is present on the ends of the bone, gets degenerated over the period of time, and because of that there will be a pressure on the one side of knee. Due to that pressure there will be rubbing of bones. If it progresses, there will be rubbing of bones. So we have to take the pressure off from the affected side and transfer that pressure to the healthy side of the knee. So if you can see over here, this is the affected side of the knee and this is unaffected side. What offloading brace does is it will apply pressure in from 3 points, as you can see over here, and it will offload the knee. It will increase the joint space. So we'll discuss about offloading brace. So now, what is compression sleeves? Compression sleeves are commonly found. I know we can commonly get it in the market. So compression sleeve is a brace which is made up of elastic material. So that compression sleeve gives compressions to the nearby muscles. So that will help in reducing the pain, or reducing the swelling, but it will not address the offloading, the pain issue, why we are getting the pain. So that is the reason we are discussing about offloading both. So as we discussed offloading brace, let me tell you the best offloading brace which is present in the market. It is Freestyle OA. So how it is different from the other braces? So Freestyle OA doesn't require any additional Adlan key or any support for application and for applying pressure. So this is a thumb wheel dial present in Freestyle OA. With this thumb wheel dial, we can increase and adjust the pressure. So there are 3-point pressure mechanism in Freestyle OA. So these two straps will apply pressure in the same direction, and the dial applies in the opposite direction. Because of that, the affected joint, there will be increase in the joint space on the affected side, and it transfers the load to the unaffected side of the knee. So as we can see over here in the X-ray, uh, here there is no joint space. So after the application of brace, there is a significant increase in the joint space. So this is what offloading brace does. So if we compare this thing with a normal brace, that will just give compression to the muscles, and only it will help in reducing the inflammation and pain. So this is the mechanism of offloading. This is how we can use thumb wheel dial. We can see that in detail, in this video.
Greg OA braces gently apply pressure to the unaffected side to align the knee, taking pressure off of the affected side of the knee. The higher the number on the thumb wheel, the greater the amount of force on the knee. These before and after x-rays show how Greg's Freestyle OA brace affects the knee.
So, these are the benefits of Freestyle OA. Let's understand the features. So features of Freestyle OA is, it is a combination of the conventional brace as well as the offloading brace. So it gives compression as well as the offloading to the patient suffering from knee pain. So it is very easy to apply because it has 4 finger pockets, and it doesn't require any additional support for the application. And it gives confidence. It is very, very low weight, so you can wear it anytime. And so these are few x-rays actually of patients who were suffering from knee pain. You can see there is no joint space over here, but after the application you can see a significant increase in the joint space. So why we are talking about joint space is we should avoid the pressure on the affected side, so that the further progression of knee pain will not be there. And that we can achieve in that offloading brace is a major knee brace which can help us in stopping the progression of knee pain without any additional medications or this thing. So these are all the benefits of Freestyle OA. It reduces this pain. It gives support. You can walk confidently. These are all benefits of Freestyle OA. So there are many patients who are using Freestyle OA in India right now. And if you want to use this brace, before that, let me tell you, as we discussed, there are different types of knee pains or osteoarthritis. So not all patients can get benefited because of get benefited by using knee brace or the Freestyle OA knee brace. So the only person who can help you to choose the right brace, or only person who can suggest you which brace or which treatment option can help you, is the doctor. So please reach out to doctor if you have any knee pain, and if you get prescribed by if you get a prescription for Freestyle OA, we will share a number or contact details or this thing form link. You share all your details with us, and we'll give a 100% free trial to you and at your doorsteps. So there are different body types due to the lifestyle changes and all. So for higher BMI patients who are having higher body mass index, there is a advanced brace this which is compact X2K knee brace. So compact X2K knee brace is a special brace which has a double upright design, and there are two hinges available on this thing compact X2K. So it can provide a better better pressure to the patient suffering from knee pain. So it can travel the hinge can travel for 12 okay. So that will give a superior support to the patients. And these are some real life or real testimonials of patients who are earlier suffering from knee pain and how they are getting benefited because of the offloading brace. So this is the before using the CX2K. You can see that she is struggling to climb the stairs, and yeah. So after applying the brace, you can see that she's walking very confidently, and there is no additional support required to walk. So this is the difference you can see after using offloading brace compared to the traditional braces. So the difference we can easily notice with the flat surface. So on the flat surface, you can see that she's confidently walking. There is no additional support required. Earlier, she was struggling to walk. So this is a significant increase in her confidence, and there is a significant reduction in the pain. So thank you very much, and thank you very much, doctor, for giving me this opportunity. So the whole purpose of giving this presentation is to create awareness among all the people about what brace is and how it can help you in treating your osteoarthritis knee pain. And I have a small request to people who have questions. Please raise the hand. We will take questions one by one as per the sequence. Thank you very much, doctor. Thank you all.
Thank you, Raman, for your wonderful presentation on the braces. Now you allow one by one those who are having a question. Those who want to talk to the doctor, please allow one by one. Thank you.
Sure, sir. Yeah. Mustafa Mehman, please unmute and ask the question.
Yes, sir. So I just want to ask, is apply to braces surgical procedure, non-surgical?
This is a non-surgical procedure, sir. No, a surgical procedure is totally replacement.
Okay, sir. Thank you. Sir, how can we get this brace?
Somebody from the Havana will contact you, sir.
Okay, sir. Thank you so much.
Thank you. Mr. Nitin Akhilesh has asked, can nighttime knee pain indicate a specific condition? I am 34-year-old, walk at least 4 kilometers daily, and work in IT. Could my lifestyle or activity
all
level?
you need to do is you go and meet a doctor near your place. We'll assess you. Once we assess, probably some amount of physiotherapy exercises should be fine. You are kind of, this much should not cause any problem. If you're having knee pain, so probably yes, meniscal tear is something which we commonly see in your age. It needs to be sorted out. This offloading brace is not one for you, sir.
Thank you, sir. Please unmute and ask question if you want. Or you can leave the question in chat box. So there are common questions, which people usually ask regarding knee pain. That most of the people are concerned about the cracking sound of their knee.
The cracking sound which you are feeling right now is basically your patella, which is hitting the femur. Okay, that is mainly because of cordyceps weakness, quadricep muscle weakness. So all it needs is a muscle activation and strengthening exercises.
Okay. Thank you, sir. Thank you. And one more question. Is osteoarthritis knee pain is only in the patients who are having higher body weight, or it can be,
It can be in very thin patients also. So it has to be higher body weight patients. They've got more the weight, the directly proportional the pressure is going to the knee. Less the weight, it is there. But most of it, the deformity are hereditary in nature, your lifestyle, your previous trauma, all those things they will take into it. It's not that thin people don't have arthritis. Very
Got it.
rarely we have moribundly obese patients who have, they are difficult arthritis. Even surgery in them is difficult.
Understood, sir. Thanks a lot, sir. And one more question regarding knee replacement. There are two types of knee replacement: partial and complete knee replacements, a total knee replacement. So, how a partial knee replacement is better, or what are the benefits of
It all
partial knee?
depends. See, what I believe is if it's only a single compartment arthritis, then this kind of braces they play a major role. I don't believe in the concept of partial knee replacement. See, if there is only medial compartment arthritis, then this kind of braces they have a major role. Only in tri-compartmental arthritis, where patellofemoral, the lateral compartment, the medial compartment, the patellofemoral, all these things are involved, then the total knee replacement is the answer. There, the brace also can't be helped.
Got it, sir. Yeah.
So, in
Sir,
my
people-
sense, this brace can completely level up with, it can stand head to head with partial knee replacement.
Got it, sir. Yeah, this is a very big statement, sir. Thanks a lot. So people, who have by profession, they have to stand for a longer time. So for them, is there any advice, sir, to avoid osteoarthritis?
See, just keep a check on your weight, be active, physical exercises, something like yoga. Yoga is very good. Okay, some kind of exercises, because see, ultimately it is the muscles which make you. These muscles are the main motors of the knee joint. Bone in
Correct.
itself, the cartilage in itself is nothing. So more strength you give to the muscle, the more knowledgeable the muscles are, more this thing, then it will be fine.
Got it, sir. Yeah. So strengthening muscle is the key. Correct.
Yeah.
So Miss Sheila Sugandhi wants to ask a question, sir. Ma'am, please unmute.
Hello. Good evening, doctor.
Good evening, madam.
I have been suggested surgery by my orthopedician, but due to my overweight, they have told me to lose weight and will think of it. So by the time I have joined gym, and knee pain is quite less, and I wear kneecaps for walking. Just last month, I went for an international tour and came. I could manage it with some painkillers and with the kneecap. Now, since they
Madam,
have said for
managing with
surgery,
painkillers is not a good idea.
no, that was only temporary, doctor, for the tour, not daily.
How old are you?
I am 69.
So how we calculate this, madam, is average female according to the census data. And what are your comorbidities? Do you have BP, sugar, anything?
I have BP, but it's under control.
Under
like
control. So average
Yeah.
females like you, they live for something around 88 to 90 years.
Oh my God. Okay.
This is the census which speaks, the statistics. I'm not giving you a number out of my head.
Okay, doctor.
And based on Indian population, it's not an international
Yeah.
population. No? Based on Indian population census, which was conducted in 2021.
Yeah.
Okay, so they have concluded that average Indian females with mild comorbidities like managed diabetes, managed hypertension, with the hypertension, the BP, everything is well managed. They
Yes,
live
sir.
up to 88 to 90 years. So my suggestion to you is you keep that in mind. So you are 69 now. So you have got
Yeah.
another 20 years, 21 years, according to the statistics to live.
Okay.
So and then you calculate whether it is a good idea to continue like this, because the need for the analgesics will only
No.
increase.
That is only when I went on the tour. Otherwise, I don't take. I manage with gym exercise, yoga, and kneecap. I don't take much medicine.
Yeah.
What is your suggestion, doctor?
My suggestion is you can give a year or two.
Okay.
If the situation is not changing, you can continue doing the same.
Okay. It's already 2-3 years I'm doing this now.
Yeah, just do it. Wait for another couple of years. If it doesn't changes, you don't have to think about any other suggestion.
I've just contacted a nutritionist who's going to help me lose weight.
Yeah.
So hopefully, if that happens, then I want to
Sure.
just avoid the surgery, nothing else.
Sure.
Scared of the surgery.
Everybody is, even I am.
How long does it take the knee replacement to cure, doctor?
It takes about half an hour to do the surgery. It takes about a month after the physiotherapy to get
Okay.
better.
People told me it takes almost a year for normal walking.
No, madam, it takes about 4 to 5 weeks now. We use robotics and other things.
Yeah,
That
robotic.
reduces the healing time, everything.
Oh,
Thank you,
thank
sir.
you, doctor,
Thank you
very
ma'am,
much.
for the question. Soumitra Debroy, ma'am, please go ahead.
Can I ask my question, sir?
Yeah, sir.
Can
Yes,
I
Can
you
you
may,
know your
sir.
name, sir? Yeah, sir. Please go ahead. Please go ahead.
Yeah. Okay. Actually, sir, I have RA, and as a SOS, I have been asked to take eticoxib. Is it okay to take it as a SOS? 90 mg.
I think there is some network issue, sir. Let me check. Just a minute.
Sir,
Hello.
Yes.
Yeah, come back. Can you repeat your question, sir? Once
Yeah.
again.
Sir, I have rheumatoid arthritis,
Hmm.
for which I've been taking lefromanidine.
Mhm.
Sometimes what happens is have these knee issues, elbows, and all that. So they have asked me to take eticoxib. So is that okay as a SOS?
Yeah, you can take it, sir. That's fine.
That's okay, sir.
Yeah,
It
that's
is
fine.
along with Pantocid.
Yeah, you can take that. That's fine.
I had met you with my mother, sir, if you don't
Yeah.
remember, at Dr. Sukrit's place.
Okay.
Yes.
You can take that.
Oh, thank you.
हेलो
Yes.
सर, मुझे भी नी पेन है. मैं 29 था, उस टाइम से ही नी पेन है. अभी 48 है.
Mhm.
बहुत नी पेन और मुझे उतना इंग्लिश हिंदी नहीं आता है सर.
क्या भाषा बात करता है आप?
हम तमिल.
तमिल. मंजुला, यू हैव टू कुछ तो किसी को जाके आजू बाजू में किसी डॉक्टर को पहले दिखाइए क्यों हो रहा है, असेस कराइए, उसके बाद इस पे कॉल लिया जा सकता है.
ठीक
एक
है
बार
सर.
किसी डॉक्टर को दिखाना है मंजुला जी.
ठीक है सर.
ठीक है.
हाँ, ठीक.
जी.
Thank you,
अभी
madam.
क्या एक्सरसाइज
एक्सरसाइज आप कर सकता है, वो कर सकता है, लेकिन आप एक बार किसी डॉक्टर को मिल लेगा तो ज्यादा अच्छा है.
ठीक. अभी मैं एरोबिक्स जा रहा हूँ, परवाह नहीं है सर.
परवाह अभी आप एक बार डॉक्टर को मिल लीजिए.
ठीक है.
हम्म.
ठीक है
Thank
सर.
you, madam. Thank you, sir. Gaurav Shinde, please go ahead.
Thanks. Good evening, sir. Thank you for the webinar. It was really good. Currently, my age is 42, sir. But till the age of 40, I never face any kind of a joint problem or the thing. But sometime from the last year, I'm facing some joint pain kind of thing. So, what should I do for the upcoming years? I never feel some such kind of a problem, sir.
सर पहले तो किसी आजू बाजू में किसी डॉक्टर को दिखा लीजिए. ठीक है, किसी अच्छे ऑर्थोपेडिक सर्जन को अपने शहर में जाके दिखा लीजिए. नंबर 1. नंबर 2, see two things. It can always change your body habitus, your habits. अभी कुछ क्या उसको बोलते हैं, कुछ चेंजेस हुआ है, कुछ एक्टिविटी में कमी आया है या एक्टिविटी थोड़ा ज्यादा हुआ है. So all these things will have to be taken into consideration. But first I would ask you to get yourself assessed.
ओके सर. और खाने में कौन सा हैबिट लाना चाहिए सर?
खाने में डोंट चेंज योर हैबिट यार. whatever you are eating, that's fine. At 42, it doesn't matter. What I mean to say is protein content थोड़ा ज़्यादा रखिए. That's good for the muscles and bones.
ओके सर। सर वो जिम में जा रहा हूँ तो वो बोलते प्रोटीन पाउडर वो लेना चाहिए या नहीं लेना चाहिए?
Protein powder के बारे में I've got a very strong views. You should always prefer the natural proteins, जो कि food natural food में मिलता है rather than synthetic proteins.
Thank you, sir. Thank
ओके
you.
सर। सर आपको अगर पर्सनली इन पर्सन कंसल्ट करना है तो कल से मिल सकते हैं?
Manipal Hospital 8:30 to 2, evening or afternoon 4 onwards. I'm in Koramangala, Bone and Joint Consult Clinic.
ओके सर, धन्यवाद सर, धन्यवाद।
Yeah.
Srinivas Dangeti, sir. Please go ahead.
Yeah.
Hi, sir. Thank you for the section, sir.
Ah.
So, sir, I think last 1.5 year back, I had a meniscal surgery. And so recently, I think 1.5 month back, I could able to have some pain in the same location.
Mm-hmm.
So when I visited doctor, he told me to have one more MRI scan. And after the MRI scan, he told me that there is again maybe the layer, the meniscal layer is decreasing in the amount. So he told me to go for one more surgery actually after that. So what could be the reason of that decrease in the cartilage, like meniscal or?
Meniscus and cartilage are two different issues, sir. I would like to see your MRI first and then come to a conclusion on that.
Because he told me that you have to do one more surgery where you can that already explained.
मैं समझता हूँ, एक बार आपको clinically देखना पड़ेगा, श्रीनिवास जी. I need to see you once clinically and then probably see your MRI and then come to a conclusion. Now, meniscus is a tissue between the two cartilage of the leg and the thigh bone, the femur and the tibia.
That MRI they told that the layer is decreased now again.
I need to see it, sir, once. I need to physically see it and then assess.
Okay, sir. I will have a visit. I'm staying in Bangalore only.
Yeah.
I will do consultation there.
Yes, sir.
Okay. Okay. Thank you very much.
Yeah.
Thank you, sir. Sir, I have one question, sir. Actually, there is a common, discussion which happens in the public that, people who are having joint issues, they can, if they have, legs of, goat and all, that will also, or if they have soup.
Yeah, very good. I mean, they're basically rich in proteins.
Oh, that will help.
That will definitely help. Chicken soup, mutton leg soup, goat leg soup, all these things are very rich in protein. The marrow.
Okay.
The marrow basically is very rich in protein.
Got it, sir. Yeah. Thanks a lot.
Okay. Yeah.
So, any question from participants? Yeah, please unmute and ask.
Okay.
I think, sir, there are no questions from